Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health Center reporting for the week of May 23rd, 2022. After a pandemic status update, I will do a brief update on children and COVID, including vaccine updates, as well as an update on the hepatitis outbreak in children, and a brief discussion of what is next. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comment section by direct message or by email to admin@rootsclinic.org. We can see here that in Alameda County, the total cases over the previous 14 days just continue to go up. We do not have a peak or plateau in sight yet, just kind of continuing to head straight up. And same thing as it relates to the 7-day % positivity of tests. We're now at 7.8% positive. We used to get pretty worried when we were over 5%. It's really hard to right now put all of this in context because we know that there's a lot of home testing going on. But if anything, we're concerned that these are underrepresentation and undercounting overall. And so as a result, we're having to look to other sources such as hospitalization, which unfortunately also is going up. We are now at 92 people in the hospital, 3 of them in the ICU. And for the past several weeks, we've kind of been hovering in the 50 to 60 area. So to see us go up to 92, hoping it's going to come right back down. But once again, this is sort of going in the same direction as cases. So I think if anything, this should be bringing us concern. With respect to wastewater testing, we're seeing wastewater testing being reported. It's still lagging by over a week, which is concerning because I think for it to be useful, it needs to be fairly updated. We're seeing reports from the CDC's dashboard, the state's dashboard, and really, it's very difficult to interpret still what this means. We are really anxiously awaiting our various health jurisdictions to let us know what this means, when we should be acting upon it, and so forth. So for right now, unfortunately, it's a tool that's out there with some promise, but not a whole lot of utility just yet. With respect to deaths in Alameda County, 1,876 people have reportedly lost their lives to SARS-CoV-2 in Alameda County. And we are still doing well with overall vaccinations at 84%, which is great. However, we are still seeing big disparities where the Latino and African American populations are about 15 points behind the average at just under or at 70% being fully vaccinated. So that leaves a significant population of some of our most vulnerable residents also being unvaccinated, about 30% of those eligible being unvaccinated. So still a lot of work to do there. And I also would like to take a look at Oakland Unified School District's testing. I guess we might get this for another week or so while school's still in session, where they're doing fairly significant number of tests that are both symptomatic and asymptomatic people, because they are doing some routine testing on students. And it kind of keeps creeping up as well. We were at about 2.6% last week, now at 3.1%. So all indicators are still continuing to point in the wrong direction. The variant BA.2.12.1 continues to be on the rise. It's kind of edging out the others. It was at 43% last week. Now it's at about 48%. We know this is more contagious, so we're just kind of keeping an eye on this. And when we look at the transmission, the community transmission map of California, just from last week to this week, we see that almost the entire state has turned red. There's very few counties that are not in the red. The entire Bay Area is in the red, red meaning high transmission, high community transmission. And that happened quite quickly from last week when we had quite a bit that were at low and moderate, or low, I guess, low, moderate, and substantial. Now we're almost all high transmission. So this is obviously a concerning development. So I want to talk a little bit about children. I've talked about many different aspects of how children have been impacted by this pandemic. But one of the biggest concerns that I've brought up repeatedly is that really this year in 2022 is when we have seen the most significant rise in cases and hospitalizations and even deaths of children from SARS-CoV-2, and really acknowledging that early on some of the narrative around COVID not impacting children was just incorrect, and perhaps some of our policies have unfortunately reflected some of that incorrect assumption. One of the ways that we don't talk about enough of how children have been most profoundly impacted by this pandemic is the loss of a loved one, a loss of an adult loved one in their lives. And we know many, many children have lost aunties and uncles and grandparents, but devastatingly, about 200,000 children in the United States have lost one or both parents. And when you take into account those children who were being raised by their grandparents, a custodial grandparent, we have 214,400 children who are estimated to have lost their custodial parent or grandparent or both of their parents. So this is absolutely devastating and has changed the lives of these children. And that's before we even get to talking about impact on the children and their health themselves. So just in terms of their lives having become destabilized by a loss of a parent or custodial grandparent, 214,400 children, that is quite massive. And in terms of the direct impact on children, we know that over 1,200 children in the United States have died from SARS-CoV-2, and that over 8,000 children have suffered from the multi-inflammatory systems condition in children, and another 68 have died from MIS-C. And what we're concerned about now is this increase in hepatitis among children, and this is really continuing to increase. We're continuing to get more information. This is really sort of an evolving situation. But there are now, I reported last week, about 450 known cases worldwide with unexplained hepatitis. Now we're over 600 cases worldwide of unexplained hepatitis in children. And that includes about 180 here in the United States. This has been reported in 36 states across the country, so it's not clustering or concentrating anywhere in particular in the United States. But 180 cases in the United States, hepatitis of unknown cause, and these are cases since October of 2021. Now remember, as I've said, the burden of cases and illness in children has only increased since then. So the big concern is that if this is related to SARS-CoV-2, we could be seeing more of this. And so it is absolutely urgent that we get the information that we need about what is happening with this particular outbreak. Now, of the 180 children in the United States who had this, 6 of them have died, and 15 of them have required a liver transplant. So this is major. This is really a significant number of children who essentially had acute liver failure. In the United Kingdom, they have also had a number of cases. They have also had a number of transplants. And so right now we're really seeing the United States, the UK, Italy, but a number of countries are reporting, and more reports are continuing to come in, some that may have happened months ago, some that may be happening now. So really it is sort of the investigation phase of what is happening. And so unfortunately, a lot of this feels reminiscent of the early days of the pandemic, of just trying to understand and piece together what is happening and why and what to do with it. but we can say that of the over 600 cases worldwide, and certainly as we hone in on the 180 cases here in the United States, that they really have ruled out all of the common, hepatitis A, B, C, etc. They've ruled those out. They've ruled out other exposures, toxins, and so on, but they're still investigating. They have found adenovirus, as I mentioned last time, although it is really unclear as to what role, if any, it's actually playing, because adenovirus is such a common thing for children to be exposed to, and we've never had cases of sort of this fulminant liver failure where it just happens suddenly that the liver fails. And the fact that there have been 15 children who've required liver transplants, 11 in the UK. This is very, very concerning. According to the United Network for Organ Sharing, about 400 children in the United States alone are actually waiting for a liver transplant. And 400 children waiting for a liver transplant. So that's from more chronic issues. So when there's acute liver failure, so when the liver just suddenly is failing, then those children get to the top of the transplant list, because without a transplant, they will die. And so you can see how this is going to obviously be having a ripple effect, particularly if this is something that is going to continue. And being that there have been questions, I think naturally, the timing sort of this increase in hepatitis cases of what we call unknown etiology or unknown cause happening during a pandemic with a novel coronavirus definitely makes it suspect that there's a relationship between the two. It doesn't appear that this is from a acute or current case of SARS-CoV-2, so it's not catch COVID, liver fails, but that it could be a post-COVID phenomenon. And we've talked about those in past briefings about how months later we are seeing some of the effects of SARS-CoV-2. We're seeing new onset diabetes. We're seeing impacts on many, many organs. So one of the investigations that is underway is really to try to find out, did some of these children have COVID previously? And if so, would that be an inflammatory condition that happened? Could it be an autoimmune condition that happened? Could it be a weakening somehow of the immune system that then when they catch sort of a more common virus like adenovirus, that then the liver fails? We just don't know yet. Could it be that the SARS-CoV-2 damaged the liver? We know that SARS-CoV-2 results in increased liver enzymes, so indicating some form of damage to the liver. We know that happens in adults and children. We've seen this already. So could it be that that damage then can't handle if another thing comes along, such as another infection, a common infection? So we definitely are worried that prior SARS-CoV-2 could be making the liver compromised in a way and less able to handle, let's say, another infection, even a very common one that was not previously known to cause liver failure. And in listening to some of the briefings that are coming out, it seems like it is just not that straightforward to try to go back and put the pieces together, because not always do we have a tissue biopsy, for example, that we can go investigate. But wherever they can, that is what they're trying to do, to try to find out, was there previous SARS-CoV-2 infection? But definitely very high degree of suspicion, given sort of the timing, given the worldwide nature of it, and given the fact that we really can't find any other connecting factor that seems plausible at this time. But I think several avenues are definitely being investigated. So what can we do about this? Well, I think one of the things that's really important, first off, is we absolutely need to protect our children from catching SARS-CoV-2. Wherever this sort of let it happen, let her rip approach came from, it needs to go back there. We need to be serious about protecting children and not just say, well, they already caught it. They can catch it again. And we have no idea, what is going to be the impact of these repeat infections, but we know that every infection is another opportunity for long COVID. It's another opportunity for damage to different organs. We know that new onset diabetes is happening with long COVID, and we know that long COVID is happening in children even when they had a very mild course or even a course without symptoms. So that is definitely concerning. So this whole thing about, oh, it's mild, that doesn't mean that it will not later result in issues, in health issues that could last. We don't know how long, and children are supposed to have decades of healthy life in front of them. And so we don't want to compromise that or risk that in any way. And it is absolutely possible that this new finding of hepatitis may be another example of this kind of late effect of SARS-CoV-2 on our children. So we need to have our children wearing masks wherever possible. We need them to be in spaces that are safe, that are well ventilated, where people who are close to them are being tested, where people who have symptoms are not coming. So please keep sick children home. We need to ensure that we are getting those vaccination rates up. Our 5 to 11-year-old vaccination rate remains the lowest in the entire county. It's only at 62%. That's great compared to a lot of other counties, a lot of other areas. But when we look at our other age groups, they're all over 80%. Vaccinated. So we do need to pay some attention to this 5 to 11-year-old age group. Also of note is that the average age of the child hepatitis cases in the United States is 2 years old. So these are our little ones, and they are too young for the vaccine. So anyone who's hearing these rumors around the vaccine being implicated in these hepatitis cases, that's just not the case. They're actually not even eligible. The vast majority were not even eligible, and those who were majority also not vaccinated. So we know that the vaccine doesn't cause this hepatitis, but we don't know if the vaccine is going to protect from it either. We just know that it will reduce the chance of catching SARS-CoV-2, and anytime you can reduce the chance of catching it, then you're going to reduce the chance of other issues. And of course, as always, we know that the vaccine is the best way to prevent the most severe impacts of that initial infection, hospitalization, and death. So definitely, this is an evolving situation. It's an ongoing investigation, and we will definitely be staying up on that. And so speaking of making sure that our children are vaccinated, just this past Thursday, the CDC expanded eligibility for the COVID vaccine booster doses to children 5 to 11, and is basically saying that children should receive a booster at least 5 months after their primary series. So we're getting to that time for those children who were sort of in the initial, who were vaccinated when it was first available towards the end of the year there. So we're at that 5-month mark, and the CDC is basically saying that I think first and foremost, the most important thing is just reiterating that 5 to 11-year-olds are lagging behind other age groups. And so they are the group that is being left vulnerable to serious illness. So in some ways, it's not surprising what I was pointing out earlier about the increases in hospitalization and cases among our younger children, because the other age groups have, for the most part, been better vaccinated. So now we're leaving our little ones more susceptible, and unfortunately, we are seeing that in terms of some of these complications and issues that are happening. And there have been over 18 million doses administered in the 5 to 11 age group. We have not had any safety signal in the 5 to 11-year-old age group. And I know that a lot of parents, of course, wanted to wait and see. Well, now you've got 18 million doses that have been administered to this age group. So you've waited, you've seen. There's nothing more to see here. The risk of being unprotected and unvaccinated is far, far greater than any potential concern around the vaccines. There have not been any safety signals in this age group. And so I think it is really important, first and foremost, to get that primary series. If your children haven't gotten the primary series, please consider getting it. And if they did get the primary series, they're now eligible for their third dose if it's been at least 5 months since that primary series. On Friday the 20th, the very next day, the Western States Scientific Safety Review Work Group, that is a mouthful, that is our Western states, California, Nevada, Oregon, and Washington State. They reviewed all of the data as well. And I just like to mention this because we know that the pandemic is affecting different places differently. And so we always want to hear from our leaders. And so this group is still ongoing where they're reviewing everything around the vaccine recommendations after it goes to the CDC. And they also gave it the green light. What the CDC also did on Thursday was strengthened its recommendations around the second booster, which is going to be the fourth shot for most people. It may be the fifth shot for people who were immunocompromised and needed 3 doses in their primary series. And the strengthened recommendations say that if you are 50 and older, or if you're 12 and older and have immunocompromised, you should get a second booster dose. So it was, before it was kind of a softer recommendation, just you can get it. Now they're saying you should get it. So 50 and older, as well as 12 and up with immunocompromised, should get that second booster dose, which for most people is going to be the 4th dose. And in more kids vax news, the Pfizer has basically put forward that their 3-dose series for children under 5 is offering good protection. So that's going to be a 3-dose series, which once again, that's really not unusual for childhood vaccinations to be 3-dose series. And they're saying that they're getting 80% protection. We will be awaiting the full set of documents to review. But what they are sort of estimating is that this may be available by early summer because there's a tentative date for the VRBPAC, which is the FDA's committee to review. That is June 15th, that they will be hopefully reviewing these under 5 vaccines from Pfizer, a 3-dose series. Also, the Moderna application. Moderna has put forward a 2-dose series for under 5s. So the FDA's got a lot to review in order to get our littlest people protected, our only fully unvaccinated population at this time, those children under 5, and certainly given this sort of concern around the potential hepatitis and the little ones, I know that parents are very anxious just in general to get their little ones protected. So certainly hoping that this will be ready within the next month or 2. So what is next? Well, from our part, we are definitely doing our response to this surge and also planning for increased surge now as well as in the fall. One of the big concerns is making sure that there are enough ways to get treated. And so I would suggest that every individual be doing the same type of preparation. Identify if you are a person who would receive treatment. Remember, it is a long list. The link is in the post. And if you would be eligible for treatment, would it be Paxlovid, the pills, the first line that you have to take within 5 days, or might you be someone who needs to go to the second line either because you have a potential drug interaction or maybe poor kidney function, or maybe we're talking about a little child where remdesivir is the only approved treatment, goes down to newborns. So knowing which treatment you would get and how you're going to get it, we know that there are some pharmacies and some community places that are doing test to treat, but we want to make sure it can be done within that 5 days. And we don't know when there is a surge if that will be sufficient or not. So it's something we're keeping a close eye on because we know that not everyone has a primary care provider. And I think that we might be assuming or taking for granted that primary care providers are just going to be prescribing away. So far, we've heard very mixed kind of experiences. And so it's good to talk to your primary care doctor if you have one. If you don't have one, please get one, and also figure out where it is that you would get treated if you are someone that should get treated should you catch SARS-CoV-2. And we are definitely turning our attention to long COVID and the impacts that is having already, making sure that we are connecting new symptoms, new issues to potential past COVID. And we encourage everyone to do the same thing. Just keep an eye out for new issues that could be related, because we're just learning more and more about this every day, every week. We're wanting to make sure that we're doing additional screening for diabetes, because we are seeing new onset diabetes as a result of SARS-CoV-2 infection, also heart disease and other issues. So we're just wanting to make sure to get screened for those. If you haven't been screened in a while, if you had COVID in the past, just make sure that you are keeping up with your usual screenings, or get on track if you are off track with those. And the latest emerging threat, I'm just going to mention briefly, is monkeypox. It is yet another virus that we are seeing, unfortunately, in many parts around the world. I hope this is not something we're going to have to be talking about. It's still pretty early in the investigation of trying to figure out what is going on here with monkeypox. So I certainly hope that this isn't going to have to be a topic that we have to visit. Hopefully this will be the last time I have to say anything about it. And in the meantime, remember that outdoors is generally going to be a whole lot safer than indoors, especially if you are eating or drinking and having masks off. And if you must go indoors, let it be in a well-ventilated space. Open some doors and windows. You may even want to have a CO2 monitor to be able to assess ventilation. But if you must be in those spaces, please wear a high-quality, high-filtration, well-fitting mask like an N95 or a KN95, particularly if you're the only one doing it or one of the few people doing it. And if you must be in such a setting, remember that shorter time is much safer than a longer time. Don't linger too long, because pretty soon everybody's sharing air. And when you are in small or confined spaces, make sure that you've got good ventilation and you've got that high quality, well-fitting mask on your face. And of course, to prevent the most severe and tragic outcomes of SARS-CoV-2, vaccination and booster are still the most effective way by far at keeping you from dying or ending up in the hospital, even in the event that you do catch SARS-CoV-2. And remember to get some exercise, some fresh air, keep your stress levels down, eat a nice balanced diet, and get a good night's sleep. We will be taking next week off due to the short week, and then we will see you the following week. Thank you so much for joining us.